Good morning students. Today we will discuss the Norma Occipitalis. So what are the different bones which are visible in the Norma Occipitalis? So two parietal bones, then the squamous part or upper part of the occipital bone. This smooth portion is the part of the Norma Occipitalis. Then the mastoid part of the temporal bone. So these are the bones which are visible in Norma Occipitalis. And what are the different sutures which are visible in this? This is the lambdoid suture which separates the occipital bone from the parietal bone. Then there is, this is known as the occipitomastoid suture. So this is the occipitomastoid suture which separates the mastoid process from the occipital bone. Now in this portion, this is known as the external occipital protuberance. This elevation is known as the external occipital protuberance, and the most prominent part of this elevation is known as the inion. And corresponding to this external occipital protuberance, the two lines they are passing laterally. You can see here. So the two lines they are passing over here. So these are known as the superior knuckle line. In some cases, just above this superior knuckle line, another lines are visible over here, about 1 centimeter above this superior knuckle line. So those lines are known as the highest knuckle line. But these lines are not seen in all the skulls. Just above this external occipital protuberance, that little above this point is known as the occipital point. This occipital point is basically opposite to this glabella portion. You can see this is the glabella, the meeting point of superciliary arches. So their corresponding point posteriorly on the Norma Occipitalis is the occipital point. Now, what are the different foramen which are visible in this Norma Occipitalis? That is, this is the mastoid foramen. You can see it is lying near the occipitomastoid suture. Now, this foramen is giving way to the emissary vein, which is connected to the sigmoid sinus internally, and it is giving way to the meningeal branch of the occipital artery. So, this is all about the Norma Occipitalis. So, what are the parts of this Norma Occipitalis? That is, what are the different bones which are forming this Norma Occipitalis? I repeat, two parietal bone, one occipital bone, and mastoid part of the temporal bone. What are the sutures which are visible? That is lambdoid suture. Then this is the occipitomastoid suture, which separate the mastoid part from the squamous part of the this occipital bone. And the rest of the portion of the occipital bone that we will discuss with the Norma Occipitalis. So this is the junctional point of, you can see the head and neck. So beyond that, the neck portion it starts. So from this external occipital protuberance, below that, the neck portion of the body it starts. Now, these are the basically different sutures and bones which are contributing to the Norma Occipitalis. One important thing I want to repeat here again, because I have discussed this point in my previous video also, that this is the point you can see here. So what is this point? It is a meeting point of these three sutures. So what are these sutures? This is lambdoid suture, you can see. And what is this suture? This is the what is this bone? This is the parietal bone, which it is separated from the mastoid bone by parieto-mastoid suture, and this is occipito-mastoid suture. So the meeting point of these three sutures, this point is known as the asterion, and in case of infant, it is known as the posterolateral fontanella. So this is all about the Norma Occipitalis. Thank you very much.